My name is Jim Payton. I served in the United States Air Force for 4.5 years. About 7 years ago, I was walking on a beach in Florida. The next thing I remember was waking up in the hospital. I had been struck by lightning and seriously injured. A guy came along and resuscitated me. I had died from that lightning strike. I spent 8 days there, kind of touch and go, life or death. In the hospital, I found out I had damage to my spinal cord and my vertebrae in my neck. So the pain was excruciating and ultimately had to have surgery about 6 weeks later. After surgery, I bounced right back. It was really a lifesaver, but the lightning affected me. I had neuropathy in my feet. The fact that I couldn't function as well as I used to, I became depressed and anxious. I didn't get along as well with my family as I formerly had because I wasn't the person I used to be. So the pain that I experienced was ongoing. The more I walked or the more I did any type of work, I would pay for it later that day. So I had to take narcotics. I weaned down to ibuprofen, but the pain's never left. It's always been present.
Quite often, veterans with chronic pain have tried numerous treatments to get rid of the pain, including physical therapy, medications, interventions, even surgery. When the pain sticks around, many people become frustrated.
So I struggled with this for 6.5 years until I saw my primary care physician at the VA, and she recommended seeing a pain psychologist. That's when I learned about cognitive behavioral therapy for chronic pain.
Cognitive behavioral therapy for chronic pain, or CBT-CP, is a treatment that has decades of scientific support behind it and has helped thousands of veterans. It's a treatment intervention that gives a person tools to control the impact of pain on their body and their mind.
Today's session will be reviewing the chronic pain cycle and pacing.
Okay.
So tell me a little bit about how pain has impacted your engagement and activity.
Since pain affects every part of someone's life, CBT-CP considers the whole person and all of the things that turn up and turn down the volume on pain.
In terms of your chronic pain, what have you observed in terms of how it's impacted your activity level?
Yeah, it feels like the pain has disconnected me from life. You know, I am kind of negative with my emotions.
Over the course of treatment, veterans work with a trained clinician to learn how to respond differently to pain. This actually changes the way pain is processed in our brains.
Cognitive behavioral therapy for me was a change in my mental perspective and my behavior, which really helped me own my pain instead of my pain owning me.
Hi, how are you doing today?
I'm good. I'm ready for my blood pressure.
Good.
The best way to manage your pain is through a team-based approach in which a variety of healthcare providers are involved.
Perfect. 130/80.
All right, that's not too bad.
No.
Seeing someone for treatment does not mean that you're not believed or that the pain is all in your head. It's actually quite the opposite. Since chronic pain is so complex, we need various approaches to make sure that all the bases are covered.
Many of the things that you're describing occur with folks over time, and we refer to this cycle as the chronic pain cycle.
I understand a veteran might be skeptical about this treatment approach, rather take a medication instead, but for me, I did the opioids. And so now that I'm able to think better and behave better through my pain by managing it myself, it's been a win-win outcome for me. I would highly recommend cognitive behavioral therapy for any veteran experiencing chronic pain. You can own your pain, you can take your life back, it can really change your perspective with relationships and then with your own perception of who you are dealing with chronic pain.